Minutes. You probably don't know this. A child is born with congenital heart disease here in the U.S. That's 40,000 children every year. And this weekend, you can do your part to help raise awareness about CHD at the Congenital Heart Walk. Dr. Dunbar Ivy, Chief of Pediatric Cardiology at Children's Hospital, Colorado, is here to tell us more about CHD. And Doctor, as you and I were just talking about, my daughter was born with a congenital heart defect. Right. I'm like so many other parents, I had no idea what it even meant until it happened to our family. Do you see that a lot?
We do. You know, it's interesting. Congenital heart disease is the #1 birth defect.
Yeah.
It's more common than autism, than cystic fibrosis, than children's cancer.
Wow.
You've heard about that just a few minutes ago, but it's a very common abnormality, and so most parents don't know about it, as you said, until they have
Right.
an ultrasound in the womb, or after birth, a murmur's heard, or the baby's blue has low oxygen saturation.
We were just showing pictures of my little one there, Emma, who went through surgery at about 6 months. She had the feeding tube, and those pictures that you see there, she's rocking and rolling, doing some hiking with us there. You know, and she thankfully had a hole that was able to be repaired. CHD covers more than just one thing, though, right? How does that work? It's pretty much any defect?
It's any defect, and there are hundreds of different combinations of defects. Some are more common.
Yeah.
So the one that your daughter had, the ventricular septal defect, is a hole between the bottom two chambers, and when the heart is forming, the walls between the bottom two chambers come together, but with the VSD, they don't quite make it. And so that's actually one of the most common defects that we see.
Yeah.
And then you hear a heart murmur because of the pressure difference between the two chambers.
And sometimes it ends up healing itself after birth, and sometimes, in our case, it doesn't.
Right, and so you just need to see your cardiologist and your physician and see how the baby's doing, and see if it'll close on its own. Most cardiologists will try to wait and see if it will, you know, close on its own rather than rush to surgery.
That was the hope for us, and unfortunately it didn't happen. But fortunately for us, she had surgery and everything's good. So why don't we hear more about this? 1 in every 100 babies, that's pretty common.
Well, I think we're not doing a good job of advocacy, and that's one of the reasons why I think this Congenital Heart Walk this upcoming Saturday is so important, so that more people understand what congenital heart disease is and think about it. And so the walk this Saturday, the Rocky Mountain Congenital Heart Walk, is to raise awareness for congenital heart disease, and also to raise money. As you know, there's no cure, and so one of the beneficiaries of the walk is the Children's Heart Foundation, which is a research organization. So we're very excited about the event.
So let's get people talking about it. The Rocky Mountain Congenital Heart Walk takes place this Saturday at Generals Park. It's right next to the Children's Hospital there in Aurora. Registration starts at 8:30. You can also register online, and the walk starts at 10 o'clock. I'm going to be there. I would love to see you. I'll have my little daughter, my family, my wife, my son. We're all going to be there, and we hope to have you as well. Ken?
It'll be a nice weekend for it. We'll check in with Jay.